Hello everyone, this is Dr. Sampurna Bhuvnesh, a women's health physiotherapist. So recently we had posted a poll regarding doubts about exercises. So I'm going to answer a few of the questions that came up to my inbox. And the first one is, I'm currently 1.5 years after delivery. Can I consult now for diastasis recti and stomach reduction? Sure, you can consult us. We are available between 9 a.m. and 6 p.m. on everyday basis. From Monday to Saturday, so you can come in person, or if you want an online consultation, do ping us and leave us 1 day time, and we will get back to you once after our regular procedures and everything is complete. So is it possible to correct DR after 1 year of delivery by doing exercises? Sure, you can do that. So exercises, actually age is just a number, and exercise can be done any time after your delivery. Only thing, just take it in mind that earlier the better is what we generally say. Even 10 years after your delivery also we can show results, but it depends upon the assessment of how much severe your problem is. It takes time accordingly. So shall we do exercises during your period? Generally, you all will be knowing the traditional practices that we need to give rest for our body during our period. So lifting up both legs and doing some floor exercises can hinder with your period flow. So it is better not to do or strain yourself during your period. It's always better to give a few days rest for your exercises and resume your exercises after your period. So riding bicycle, hula hooping, is it good for diastasis recti postpartum moms? Okay, so riding a bicycle, generally what I would suggest is, if you have a right posture, for sure you can do it. But if you're riding a bicycle on a faulty posture, I would surely not recommend you doing bicycling for diastasis recti. And hula hooping is another thing which involves entirely your abdomen muscles. So the hula hooping is completely not advised for a diastasis recti person. So we need to have a proper assessment for how much intense your diastasis recti is. Accordingly only we can do the programs. So what I can surely say is, if you want riding a bicycle or hula hooping as your main goal, we can surely train you up for that. So but make sure we have to give enough healing for the diastasis to settle completely, and then we can slowly increase your fitness, and we can do hula hooping or your bicycling also, provided it is done in the right way. But if you're doing it on the wrong way, rest assured that you don't do it at all. That's the best thing that you can do. So which is much needed exercise for female during long time? So for a woman, every time exercises are important, but it depends upon the stage of a woman. For example, if you're in an adolescent phase, you can try a lot of athletics, you can try running, hopping, skipping, these kind of exercises. So if you're a pregnant woman, for sure you have to restrict your exercises according to your pregnancy needs. So basic exercises to relieve your pregnancy discomforts, some basic balance exercises with your Swiss ball. So these kind of exercises can be helpful. When you are in your postnatal phase, make sure you don't have any kind of issues like diastasis or umbilical hernia or something like that. If you have certain kind of issues related to this, you have to stick to an exercise protocol which generally focuses on an umbilical hernia or a diastasis recti, or according to the women's needs. Because after delivery, all of your needs, your body needs changes. So we have to evaluate properly, and we have to have a proper assessment before suggesting you an exercise program. And if you are a person in the menopausal age, we would recommend you to do some strength training. And for women who have already delivered, strength training is one of the most important exercises, so that you can handle your baby better, you can get rid of all of your aches, pains, everything. So but for every stage of women, exercises are needed, but choose your exercise wisely. Is there a cure for sacroiliac pain after 7 months postpartum C-section? For sure we can relieve the pain and discomfort, provided we need to have a proper assessment of the condition, and we have to check if there is any kind of inflammation, because sacroiliitis generally says that it's an inflammation in the sacrum area. So we have to see if there is any kind of issue or any pain or tenderness or any kind of inflammation is there in and around that particular area. Then we can relieve your pain and discomfort through a lot of physiotherapy techniques like electrotherapy, dry needling. We can use a lot of manipulative therapies, and there are so many physiotherapy techniques to relieve pain. So for sure we can do that, but it has to be done upon an assessment. Suggest 3 poses for down facing dog. Okay, so for down facing dog and everything, I just want to know for what you want this exercise to be suggested. And this is one of the yoga poses which goes inverted. So it is basically to relieve your flexibility and to improve your core muscle, to make your core muscle stabilized. Also this exercises can be used for all of these things, but I need to know for what you want this exercise, because we generally go with an exercise prescription for any kind of conditions. So for what kind of condition you want this exercise, or what kind of variation or modification you want for this exercise, if you can detailedly explain me, I would be able to give you a proper answer for this. So shall we do belly massages during periods? So as I told you, like during your period, generally make sure whatever things that makes you more comfortable, try doing those kind of things. Instead of going in for a belly massage or something like that, I would recommend you to go in for a warm water fermentation, and you can use your own fingertips to slightly do a circular massage or something like that, to completely relieve your pain and discomfort, and completely understand that massage is just a temporary pain relief method to increase your blood circulation only. So thank you so much for all of your questions. Keep inboxing us with all of your questions, and we would answer you as early as possible. Thank you so much.